This is Dr. Scott Kellerman's hospital, the Bwindi Community Health Center, located in the remote southwestern corner of Uganda.
Mukugamba umukora mu kuteekateeka nanga no migendere yetu nyamuhanga no mirebere yetu netushisha imukama ako harimo kuligira kwinji harimo kushisha.
It took a while to get settled here. Initially we lived in a remote area even for here, and would come around to these villages of Batwa and would do roving medical clinics, mobile medical clinics. We'd treat the cerebral malaria, the kids that are in a coma, hang IB bottles from the branches of trees, tie them up with vines, and then just give quinine drips to these patients.
Scott Kellerman's an amazing individual. What he's done at Bwindi for the Batwa and for the Bachiga in the area. He's known all over Uganda. I traveled around for 2 weeks before I made it up to Bwindi. People would ask me what I'm doing in Uganda, and I said, I'm going to be going to work at the hospital. Everybody knew about Scott and his fantastic reputation, and he seemed to have accomplished a lot.
We built a maternity unit because the maternal death rate is about 560 to 570 deaths per 100,000. So it's the highest death rate of any place on the face of the earth, maternal death rate. And when a mother dies in pregnancy, the child dies, and then she leaves the kids orphans, and frequently the father can't care for the kids, and it's a tremendous devastation. 18 children, 11 survive. That it is a problem that they just don't have enough. These children actually, what has happened is another child's come along, these kids have been bumped off the breasts and they've been put on bananas. That's the typical staple in the diet. We did a study, we did our initial survey in the year 2000. 38% of the Batwa were dying, children were dying before the age of 5. We repeated that survey in 2004 and found out the death rate dropped from 38% to 17%.
This community health center was originally built for the Batwa people, but today it's come to service the entire local community. Now, while local community members still pay a nominal fee for their health services, if they can afford it, the Batwa still receive all their health treatment for free.
The Batwa Pygmies were the previous inhabitants of the Bwindi impenetrable forest. They lived there since time immemorial. Even Homer recorded them in the Iliad from 2,700 years ago. However, in 1992, the Bwindi impenetrable forest was changed to the Bwindi impenetrable park when it was made a World Heritage Site in order to protect the endangered mountain gorillas. 650 mountain gorillas in the world, 350 live within the Bwindi. Good news for the mountain gorillas, bad news for the pygmies. And the pygmies were evicted from this park. And because they had no title to land, being hunter-gatherers, they were given no compensation, no food, clothing, shelter, or any land. And they became conservation refugees.
Dr. Kellerman and his wife have gone to devote a period of their lives working with people who are a long way from the United States, people who clearly have been underserved, people whose existence most of the world know nothing about, but people who are in great need for the basic necessities of life. And he's been able to come in and use his profession that of medicine, in making their lives a little better, a little more fulfilling, allowing them to live longer lives and happier lives.
We see a lot of malaria. So as a result, 2 months ago we distributed 1,000 bed nets. Next month we're going to distribute another 500 bed nets. So if we can be involved in prevention of malaria, it's much better than trying to treat it. Malaria kills 1 million kids in sub-Saharan Africa under the age of 5 every year.
I'm also a very firm believer that the right person with the right inspiration, the right zeal, the right drive can make a world of difference. And I think that's what's the case with the Kellerman. Both Scott and Carol, there is a dedication, an enthusiasm, a passion about what they're doing that has given life and soul and a beating heart to the clinic.
They're incredibly happy. They have a lot of hope. You know, we think hope is a future term, but for them, they have a lot of hope right now. So they're not really anxious about the future, and they're very hopeful people, and they're very proud people.